All right, good afternoon, everyone, and thank you for joining us for today's AAA Cost Collection webinar on revenues. Today's webinar will be presented by Asbel Montes and Katie Arens. Before we get started, I wanted to let everyone know that if you'd like to ask a question throughout today's presentation, you can use that Q&A feature on your menu. Our panelists will try to get your questions either throughout the presentation or they will address them at the end during the Q&A portion. I will be sending out an email this afternoon with a recording of today's event, the PowerPoint slides, and the NAC certificate of completion. We also want to thank Savic Buying Group, who is the exclusive sponsor of all of the AAA's cost collection webinars. Savic has also provided a grant that allows services to receive all of the AAA's cost collection education free of cost. Savic's Executive Director, Mickey Schulte, is on the call today to say a few words and hand it over to our presenters to get us started. Thank you, Mickey.
Thank you, Megan. Really appreciate it. I hope everyone is well out there. Savic is again proud to sponsor the cost data collection series of webinars. And we're really thankful for the AAA to put this on and everything that they do to help support the industry. So from the Savic end of things, we have a couple of new things that might be interesting to you. UVC lighting and fogging solutions for disinfecting ambulances, your break rooms, anything like that. We have new bid approved vendors for them that are there and ready to be used. If you haven't ordered your winter coats, your jackets, your parkas, I can tell you that 511 through our Savic store has been very busy this week. If it's that time for you, get in line, take advantage of our great pricing, and get them early. We have an exciting new launch that we're going to be undoing here in a couple of weeks. So in about 2 weeks, we'll have a great new program that not only will help agencies, but it will be a great free perk for all of your employees, and they're going to love it. If you haven't already gone to our website, please take a couple of minutes and go over there, savic.com, savvik.com. It takes less than a minute to join us, and you can see all of the things that are available free of charge. And remember that a portion of the when you use a Savic contract, a portion of what you earn comes back to the American Ambulance Association and helps sponsor webinar series like this. So thank you again for the sponsorship and the support. And now I'm going to hand it over to Asbel.
Hey, thank you, Mickey, and thank you for all that you are doing and supporting these webinars. And good morning or good afternoon, folks, from you that might be joining us from either the West Coast or the East Coast, depending upon where you are. But we're glad, Katie and I are glad that you joined us today for the webinar on revenue in this cost data collection series. As many of you know, that if you've been attending these series, our faculty, we're very pleased with our faculty, and it has broadened over the last few years. And very excited for all of my colleagues here as well. But here is a list of the faculty. But today it's me and Katie discussing with you on cost data collection. And again, to reiterate Megan's point, as we are talking, notice the Q&A button in the bottom, and we will try to get to your questions live as we can as well. So please feel free to answer to ask questions as we work through this program, and we will try to answer them in live fashion, or if we cannot get to them as this webinar ends at 2 o'clock, and we will make sure that we follow up with you as well. So just so you know, for you that are in AAC, this is for 1 hour of continuing education credit. So just make sure that we know that information. If you are registered, make sure that we know that you need that CEU as well if you have not already disclosed that, and we will make sure that we get that information to you. And we love our lovely disclaimers here as well. Just know that the faculty here is not giving any legal, financial, or accounting advice. You do need to seek that from your own legal and accounting professionals, and this is just informational purposes only as we work to get information out to the industry. So lovely disclaimer, I did that check, and Scott, if you are listening, we can check that off that we did the disclaimer. Okay, let's get right to business with the revenue cycle or the the revenue side of this webinar. But before we get there, of course, many of you have seen this, and we continue to disclose this. There is a reason for this. Repetition means that we eventually will begin to understand it. Like they say, how long does it take for you to build a habit? You got to do at least 21 days. And so we're continuing to repeat this because we want to make sure that everybody understands the clarity of what happened. Most of you already know, and if you don't, then this is going to be new news for you, but I doubt it. But if you were selected in the 2020 calendar year reporting, that has been delayed. CMS did clarify that as well on July the 31st of 2020. That reporting for 2020 entities has been delayed to 2021. So that does mean that there's going to be 2 rounds of reporting done in the same year. But if you were selected in 2020, the reporting is now not due. You're going to be reporting in calendar year 2021. Just to give you a little bit of update on the reporting timeline, as I reiterated earlier, this is a continuous 12-month period in year 1. So you will now report your information during a 5-month period starting in 2022. So basically it's 5 months, guys, from the date of your calendar year. So if you're on a fiscal year reporting, for instance, if you are July the 1st through June the 30th, then it's 5 months from the ending of your reporting calendar year. And also remember, if you were selected, you should have already disclosed what your reporting calendar year was, or it automatically defaults to the calendar year. So remember that as well. And we are expecting, guys, sometime in December for the 2nd year or year 2 notification to happen. And then that way, hopefully, we of course will get information out to you right now. But year 1 has been disclosed. We know by May of 2022, or the 5-month period afterwards. If you're on a calendar year, it's going to be May of 2022. That's for year 1 reporting. And then year 2, we should know sometime in December is typically when that happens. And you will not, guys, and I know this is something that we talked about as an industry, if you were selected in year 1, you're not including calendar year 2020, and a lot of people were disappointed by that. And I do know we'll get to the discussion of the Amber software, where we can still kind of keep track of the COVID-related expenses. But if it's 2020, that will not be reported in this data analysis or data collection period. So this is what it is going to look like on this slide. As well as, you don't need to worry about doing screen grabs. Megan will make sure that the attendees here get copies of this presentation as well. Unless you want to do screen grabs, feel free to do that. But this information will be available to you. But this is the reporting period, to give you some examples of how that would look for you. And remember, it is not based upon a calendar year if your accounting period was not a calendar year. So just remember that, and we kind of gave you some different highlights here on what that would look like, but you need to have registered that. If you were selected already, should have done that. If you are coming up and you weren't selected and you're attending this webinar, just remember, we do expect that announcement to happen sometime in December. That is about approximately what happened for year 1. And then you'll be given time to select your accounting period if it's not on a calendar year as well. So just so you know, there are some hardships. And that might be relative to this piece, that there are some provisions for hardship. So it can be requested if your organization does not have sufficient data. And you will need to fill that out. There are specific guidelines, though, when an organization can request a hardship. We will have that information at the end of this presentation, where you can go if you want more specifics on that as well. We've also got webinars attached if you're a part of this on how you can work through that process. But there are specific guidelines, but we do want to cover that because some of you might be experiencing that. There are some hurricanes that have happened, all of that as well. Just so you know, CMS will provide specific instructions at the end of each data reporting period, so know that. It must be requested within 90 days of the date that CMS notifies you, or that 10% reduction will apply, okay? You'll have to submit evidence, and you're going to have to provide data or what have you. Of course, whenever you do anything that's of a hardship related, just know you're going to have to provide information. It's not just assigning an attestation that you need a hardship. So just remember that, folks, as well. Just a note too, guys, the SAVIC grant will apply through the 2 year as well. So if you're worried about that, that has been noted too, and I should have probably addressed that earlier. But because of that delay, the SAVIC grant has been extended as well. And we'll get to that as we kind of wrap up through this process. Let's see if I can keep moving here. Sorry. Implications of the delay, guys, and this is a few areas that I know that a lot of us were concerned about, and we're kind of trying to reiterate this, is the missed opportunity for pandemic-related expenses. Also, the most notable one is the lessons learned from year one. And also, it limits the data to one pass period before the MedPAC report to Congress. And so a lot of us that do advocacy work as well, of course, we're already talking through that process. And so when we discuss AMBER at the end here, if you've not signed up to do AMBER, or you're only doing this webinar piece and not the AMBER piece, there's going to be a lot of information and discussion that we're going to be having about moving things through AMBER, because it's going to be important that the industry has some data that we can begin to be proactive in our advocacy and not reactive. As an industry, of which those are music and sweet words to my ears and Katie's ears, that we are being proactive and not reactive. And so this is a one element that I will tell you the American Ambulance Association has done yeoman's work regarding putting this AMBER piece together that a lot of us have been working on, and it's a great product to make sure that we don't see some of the implications that we always know one pass of data does. So why are we still talking about CMS cost data collection? Because there's been so much going on in 2020. It's not like we haven't had one whammy and one disaster after another, and then a public health emergency on top of that. And so it's really extremely important that we continue to put this information out there. We cannot get distracted, folks, by anything else at this point in time. That data collection is still important. And as you can see here, it's even extremely important with now HHS reporting in all the CARES funds you've been getting. So it's kind of, if you have been already prepping for data and already setting your systems up appropriately for data, you're a step ahead of what's going to be required under the reporting guidelines that you're going to have to submit, even though we're beginning to wait and look for the actual tool for those CARES funds. But most of you have received probably CARES funds that you've received an aggregate of over $10,000. So there is going to be some reporting required on that. And quarterly reports to be filed. And you're going to have to know how to tease out your expenses related to that, your lost revenue. And so if you've already been working and doing this data collection tool, you're a step ahead of being able to provide that information when that tool finally comes out on what the reporting requirements are going to be. So, sorry, I'm skipping ahead here. The COVID-19 stimulus funds, just so you know, folks, and there's been lots of questions on this, and I'm not going to go too much into detail here, but I probably, with the new general allocation of the third tranche of funding that has come out and people are beginning to put into it, and now they're kind of looking at, well, wait a minute, I may have received more. How can I use this? Can we use it for workforce training? I mean, I've gotten calls about, can you use it for EPCR and licensing fees? Guys, yes, there is a lot of openness to this. There's also an FAQ, and I know the FAQ is like 58, 60 pages long on some different, but the one key thing here to look is this phrase right here: to prevent, prepare for, or respond. There's also a phrase in there that talks about maintaining your service throughout the coronavirus. Okay, a lot of people have been talking about workforce challenges. You're having to increase, you're competing against rates that they're making by going and doing COVID testing, and they're offering 2 and 3 and 4 times to EMTs to go do state contracts or whatever. And so many of you guys are having to increase your salary cost of that. That is all attributable to maintaining your service. So rethink that. You might be doing workforce training to maintain your service, to keep that through the process. Licensing fees for EPCR, treatment in place. You're doing some other things like that, folks, is stuff that is relative to the use of the funds for COVID-19. Now, I could go on a lot more stuff for that, and we've done some Q&As regarding that piece as well. But keep your questions coming in, folks. We'll get to your questions as we kind of talk through. I see the Q&A buttons are lighting up, but we'll kind of work through that and get to you as we work through this process. But remember, understand that the terms and conditions as well. There is that balanced billing and surprise billing that everybody said, but remember, it's just for presumptive patients and positive patients. It's not for everything. It's only for those that have been tested positive or presumptive for COVID. As well. And remember, it's not free money. Think of it like a grant process. If you don't use the grant funds, you send them back unless you can prove through documentation that the money was needed. So it's not like just saying, here's money, great, keep it, and you don't have to provide any backup documentation for it. You absolutely do. And if you keep up with your data, if you have a good accounting system, this is what we're talking about. And we'll talk through some of the revenue process today, which is on the revenue side of it, because there is a lost revenue component. As we go through some of the data elements, that might trigger some things for you in understanding the use of the CARES funds. So as you know, and I'm not going to belabor the point here, but for those that did not know, repetition, remember this was a part of keeping our extender for 5 years, which expires the end of next year. I'm sorry, the end of in 2 years. It's passing very rapidly for a lot of us. It's like nightmares are starting over again, that we are going to be advocating again, more than likely, for another temporary extension because the data will be incomplete. And we're already working on that as the American Ambulance Association regarding this. But data collection, folks, was a contingency of those infamous extenders on the urban, rural, and super rural area as well. So why is cost data collection critical to us? Many that have been attending these webinars, attending many of with not just this faculty, but many of the webinars that the American Ambulance Association and many of us have been talking about, is to reform our payment system. Ultimately, folks, that is what we want to do. However, remember what the mandate was in the Bipartisan Budget Act of 2018. It was to validate our current payment system. So I don't like to get away from that, because that really is ultimately the charge in the BBA of 2018, is to validate our current reimbursement system as it stands. Now, what we as an industry would like to use the data for is to reform our payment system and methodologies. Hence the reason why we are doing so much training on this, because of the long-term implications to this. And we want it to be positive. So we want the information there to be able to do different things, to open doors for the innovation that we're doing. Hello, the treatment in place is one thing. We're advocating right now for a package on the Hill to cover us for treatment in place at the ALS equivalent rate. What if it should have been more than the ALS equivalent rate? The problem is we don't have data to substantiate anything outside of our current reimbursement model. So that's a good example, folks, that if we had had data, we might even have a different talking point in advocacy for how it gets reimbursed than what we're currently advocating for, but we have to work within the confines of the system. But this is the reason why cost collection is so critical to us. And as we continue to evolve, because we understand logistics, not just transportation logistics, but logistics in general as we manage patients, this helps us as we continue to evolve as an industry. And then it is critical, guys, that even if you aren't selected, don't just dust it off and say, thank God, whew, I can put that on the back burner and wait until next year to address this. It is very important for you to engage, because remember, those that are providing the data right now could be determining your future. And that is why it's extremely important if you aren't, and for instance, my company wasn't selected, but there's a reason why we're engaged, because we understand the first pass, the second pass, and possibly the third pass could have some short-term implications of how the data is gathered that could be very impactful to everyone at this point. So the rising tide actually lifts all boats, but actually it can sink boats as well if we're not careful, because it throws them into the rocks or something like that, and we're not paying attention to the process. So remember, we got to be diligent through this process as we work or what have you. So many of you have been through these 13 sections, and as you know, we have been going down the list as we've done these webinars in anecdotes. And so try to make them concise and on point on certain subject. And this is the last one in this 13 section process of the 45-page data collection instrument that was revised as of July the 31st of this year. And revenues is what we want to discuss and we want to talk about. And so thankfully, I've got my colleague here that also sits on the data collection panel with us, faculty, Katie. And Katie is here to talk us through the revenue and the revenue portion and why it is important for us to understand. Before she begins, this is something that the American Ambulance Association advocated hard to be included in the data collection instrument, and to the granularity that we asked for it. It is not typical in cost data collection tools in the healthcare industry to get to the granularity that we requested, and they actually agreed with us because we knew that this data was going to help us further to show our uncompensated care, to show all of these other things that we're doing as well. So Katie, I'm turning this over to you.
Thank you, Asbel. So Asbel kind of touched quickly on this, but why is it important to report our revenue? So why did the AAA advocate so much for us to be able to include our revenue data? And really it comes down to, how do you get to the calculation of whether you know there's a loss there? And if we don't have our revenues included, we've got every other expense there, we've got our labor expenses, we have our costs, but how do you know if the costs are actually truly covering what you need them to cover? And that's why it's so important for us to ensure that we're including our revenue, and not only including revenue, but we're able to break out the revenue, which we're going to talk about today, and what the benefit is for that. So there were some recent FAQs that were actually published by CMS back in July, late July, and a lot of the FAQs actually to CMS's, what they did was they did answer a lot of questions for us pretty good. So one of them is, how is revenue defined for the purpose of collecting and reporting data? And they defined it as indicating, report your gross and total revenue dollars received from all sources during the data collection period. I think what's really important for us to note here is really the third bullet, in that a lot of people had asked, well, what if we're collecting revenue on services that we provided in the year prior? And obviously in our line of business, that's very common, right? We're still trying to collect on revenue that we billed today in October, potentially from last year in October. We all know how much harder we have to work to get that revenue in the door, and unfortunately it takes a lot of time. So they recognize that we may be reporting revenue during this reporting period that doesn't correlate with your expenses or cost that you're reporting in other areas. So section 13 specifically is only asking for revenue that's related to your ground ambulance revenue. And many of us, like ourselves included here at Life EMS, we have multiple NPIs, and so it's important that you're able to carve out the revenue for the specific NPI that's been chosen for this reporting period. You have to ensure that you're able to carve out, so you're not including revenue for other NPIs or other, revenue sources you have that are not registered. And I think it's important to note here in PACOS. So PACOS is where CMS is looking to basically pull the organizations that they're picking. So if the revenue that you're including is not associated with the information you have in your PACOS account, It's really important that you're able to carve that out. Make sure you're only reporting on revenue that is related to the organization that they have chosen for this current cost collection period. Now, they may come and choose another NPI or another provider number later on, and at that point, then you could report that revenue there. And also, do not include air ambulance services in the following questions that they're going to ask. So the first question is pretty straightforward. You're just going to essentially put in your total revenue from all sources that you received in your reporting year. Think of this as essentially your total you're trying to balance to. So it's a little backwards, right? You're going to say, this is the revenue we recorded or we received in this reporting year. And then the following questions, you're going to carve out, where did that revenue come from? Who was the source? So this is what you're trying to balance to. So can you report, the second question is, are you able to report your revenue for ground ambulance transports from individual healthcare payer categories? So in your system, are you able to say that X dollars were received by Medicare and X dollars were received by a commercial payer? That's what they're asking here. So if you are unable to actually carve out who your payer sources were, then you're going to say no. And then unfortunately, the next question is they're going to want you to put in what your total revenue is. So I think it's important that we recognize we need to be able to report where that revenue is coming from, because they're going to ask for Medicare revenue, they're going to ask for Medicaid revenue, they're going to ask for commercial revenue, and we want to be able to show them that X dollars received were from Medicare and X dollars received from commercial. And is there a discrepancy there that we already know lies, right? So it's very important you're not estimating. You need to be working with your vendors to ensure that you can get this information. Obviously, we've had an additional year provided to us kind of to be able to get prepared for that. And so you should be starting now to try and report that information, pull that data, and then input it in Amber so that you can be prepared when you have to actually report. And I think I just want to also mention Amber was created by the AAA so that we can ensure that the questions we're asking are in our nomenclature, they're in our vernacular, they're in common language that we speak, because I think the next slide really kind of proves that point. So the third question in the revenue section is they're going to ask you, did you receive, first off, revenue from one of these payer sources? So the first column is, was revenue received during calendar year, first year will be 2021. Did you get revenue from traditional Part B Medicare? Yes or no? Did you get revenue from Medicare Advantage, Part C? Yes or no? And so you go through and you just mark yes, yes, yes. Nope, I didn't bill TRICARE. I didn't receive any revenue from TRICARE, at least in this reporting period. You would mark no. And then the second column is pretty straightforward. What was the total revenues that you received from that payer? The third column, I think, is where they're asking, and it gets a little convoluted, because what they're really intending to ask is, in the dollars that you're recording, your receipts you're recording in column 2, are you including the portion, the cost share? So are you including that you billed or you received, say, from Medicare, $300, and the patient also paid their coinsurance amount, which was $70. So the $300 is including the $70 payment you received from the patient as well. That's what they're intending to ask here. It's worded a little different. So you would say yes. In column 2, I'm saying I received $700, even though 30 of that actually came from our patient. So if in your system, you're not able to carve out secondary payments or patient payments from your primary payer, then you're going to want to say yes in this column, and then make sure you're reporting all of that revenue in column 2. But you also want to make sure at the very end, they're asking you, did you receive revenue from patient self-pay? And this is where I think it gets confusing, because they're asking, was it for patient deductibles or coinsurance? which really that's what cost sharing is as well. So you want to make sure you're not reporting those patient copay amounts in this last section and in the third column, because you're reporting revenue twice and your data is not going to be consistent, and it's going to look like you're receiving more revenue than we actually truly are. So another FAQ that came out in July was, in reporting revenue by payer, my organization is unable to separate out Medicare Part B or fee for service from Medicare Advantage, or the same with a Medicaid and a Medicaid managed care. And so going back to that as well, it really, the ultimate goal is that you are going to be able to separate it out. And CMS actually said the same thing. They said it's important that you report on the different sources of revenue that your organization receives. Reporting revenue from Medicare fee-for-service and Medicare Advantage into one source of revenue could distort the data. So they're even recognizing, because we all know that what we receive from Medicare Part C, as far as revenue goes, is sometimes less, most often will be less than what we're getting from Medicare Part B, because the coinsurance amounts are so much higher, okay? So if you're, you're trying to collect $250 from Medicare Advantage, that's different, obviously, for coinsurance amount than what you're trying to collect from a Medicare Part B, where it's typically just that 20% of the allowable. So this is another question where I think they didn't ask it very well. It's very confusing, and I know this has been a common ask. So they're asking you here, how often did your organization bill the following types of payers for the amount owed for transport during the reporting year? What they're really asking is, if the patient had this insurance, how often are you billing? So for instance, if the patient has traditional Medicare, do you always bill traditional Medicare in that situation? It's not asking about your payer mix, like, oh, we sometimes do bill TRICARE because, we have patients that have that insurance. No, it's if the patient presents and they have TRICARE as a payer, they want to know that you're always going to bill TRICARE first to deem if there's coverage there. And actually, I'm going to turn it back over to Asbel, and he's going to go into other sources of revenue and try to turn that into something we can all understand. So,
and I think that is just a segue off of what Katie just said on that last slide. Is it's extremely important, guys, that you answer and understand what she just said. Because especially there are lots of entities that do not bill the patients for their copays and deductibles. Many governmental entities operate under a safe harbor where their tax base or a patient's paying a tax, and so there are certain ordinances that indicate that they won't get a bill, so they would never bill for self-pay code. So it's really important that if there are certain entities that you are not billing, that you make sure that you answer that correctly. So when they are parsing through the data, it's reflective accordingly, and you answer that. Because Katie, what she just indicated, is not asking you about your payer sources, it's asking about your frequency of billing and billing that payer source. So the other revenues, and we did have a few questions here that I'm going to answer live as well. This is where it gets into, folks, of all other revenue that's related to your NPI that you receive that is not tied to an actual claim filing or a payer. So this would be subsidies that you receive. This would be information, and there lots of questions like this are happening in this public health emergency as people are trying to figure out lost revenue and what can I include in lost revenue to use for CARES Act funding. So for instance, if you receive funding from property taxes, or you might be a governmental entity or a nonprofit, there could be something to where it says, you know what, out of the property tax, 20% of that property tax goes to EMS, 10% goes to fire, 10% goes to police, and the other goes to something else. Yes, you would include the portion of revenue that you receive. That could be revenues that you get from donations that you might do. You might have donations that help offset and fund certain things. You could be getting grants from state or local or federal or foundations that are helping fund some of your provisions of service as well. This could be relative to contracts that you might have with facilities where you don't do any type of billing. And I'm not really saying that this is like the DRG. There's some types of contracts that people have with like standbys, different things like that, that would be other revenue that you might receive for those type of services as well. So this is really revenue outside of what you would bill through a claims filing in your billing system. It's the easiest way that I like to summarize that. I mean, there's always exceptions to that, but if your billing department isn't billing a payer source like Medicare, Medicaid, insurance, or something like that, and it's not a fee for service where they're billing AO 428, AO 429, BLS emergency, and it's another contractual arrangement that's bringing in revenue, this is where your other revenue would go, if that makes sense. And so when you're walking through this, it's going to ask you, so let's just say you're getting revenue from other payers that are not contracts with facilities above. You're going to say, yes, we do. And then you're going to put that dollar amount in there. And then you're going to say the percentage that's attributable to the ground ambulance service portion of it. So for instance, let's take the property tax piece that I was talking about, that somebody had just asked this question of me 2 days ago about how they would do that for the CARES Act funding and how do they put that into there. Well, if 20%, if you got $1 million a year in property taxes was received off that, and 20% of that was for EMS and the provision of ground services, then you would put 1 million as the total amount received. 20% of that is for ground ambulance services. So that's kind of a real world example. Some of you guys have membership programs. And if your membership program covers air and ground, then you need to be able to understand, you know what, we got $2 million in membership fees, and 1.8 million of that is associated to the provision of ground ambulance. Okay. And so you would put 80, what you would do, whatever, 80% of that or 90% of that. I'm not doing the math in my head as well. Charitable donations. This is very common amongst fire departments and nonprofits and rural and volunteer agencies. If you're a volunteer fire department that also does EMS, and you get donations on that, then you figure out how much of that was, what percentage of that donation received through that calendar year or fiscal year was associated to the ground ambulance division. And that's where you would put that kind of stuff there. So the easiest thing to do, and there's different sources of revenue that go through in other revenues, but the easiest way to identify other revenue is for things that were received for the ground ambulance operation piece of it that was associated with it. If you got revenue and you're an entity that has all different types of operations, and for instance, it was a funding for a police drive and you're part of police, fire, and EMS, then that funding would not be attributable to you at all, because 0% of that was because it was 100% allocated to police. But if it was divvied amongst fire, police, and EMS, then the percentage that was allocated to you, to report the total dollar amount received, and then the percentage that was allocated to your ground EMS division. This is where you're going to do that. Subsidies, taxes, anything relative, assessments on utility bills, which is very common in the EMS industry as well, depending upon, I mean, you might have private would be in there. Other revenues like these bridge funding programs that are happening that are not attributable directly to line item. You might be getting an X amount of money in bridge funding that's going through this process. This is where you're going to report that. You've got demonstration grants, guys. There's a lot of grant funds that you're receiving through demonstration programs. Hello, if you're part of the CMMI ET3 project, you're going to see some things that are happening there. Fire safe grants, things like that you need to be, you're going to need to look at. So there's a whole bunch of stuff here that you can see where you earmark it in that thing. And then of course, if there's nothing in here and you've got revenue, then other would be where you would put that, and then you would specify it based upon your ground. If 100% of that funding was attributable to ground, then your percentage is always going to be 100% in that column. If you're an entity, for instance, that all you do is ground ambulance service, then you're not going to have to worry about what percentage is there. It's always going to be 100%. If you are sharing the model with air, or you're a governmental entity sharing it with fire and police, then you would put that percentage accordingly. So just know that, and a lot of this would be if you're a dual system, especially if you're a private operator doing air, you're going to need to understand that if you've got other revenue sources that are coming in that are not in the payer category as Katie just discussed earlier. Next slide, Katie. So guys, we have got a few questions here. And we've got, so I'm going to recommend that you look at the Q&A, and there's a few things here that we will go through and answer live here that I may or may not have answered already. But there's one about the fiscal year reporting, if your fiscal year is 10/1. So if you're, let's just take it real live and what we know there's been a delay. If your fiscal year is now 10/1 of 2021 through September of 2022, then it's going to be 5 months following September of 2022, which puts you into February of 2023. Would be you would need to have your data reported by then in order to not assess the 10% penalty as well. I did go over the subsidies, Thomas, so thanks for answering that question. That's going to be in the other revenue category. And it's going to be 100% allocated to you as a ground, unless you do air and ground or you're a governmental entity, then you'll do the share of how that subsidy works based upon your allocation model as well. And then I think Katie is going to answer your other question. Katie?
Yes, so the question was payer-based frequency chart, self-pay included co-pays, but before in another slide, we were not supposed to include those dollars in the self-pay section. So good question. So the payer-based frequency chart is asking, do you always bill the patient for your coinsurance? So you don't want to report the dollars twice where you're actually reporting the revenue received. That's where we're saying if you're going to include the patient coinsurance amount in your Medicare total, then that's okay to do so, but you're going to indicate that yes, it's included. But the frequency chart is just asking then, do you always attempt to bill the patient to receive that copay or deductible? So hopefully that answered your question.
And that's where it gets confusing, folks, in the revenue. We would have probably have worded it much differently.
Yeah.
But unfortunately they did. So we're having to explain that really the intent of that payer frequency chart was to try to bifurcate out there those entities that don't bill, or they sometimes bill some people their copays and some they don't. So you might have a service that the ordinance is indicative that the tax goes to emergencies, but non-emergency, they get billed copays and deductibles for. So they might sometimes do that. And so they're lumped into categories accordingly when you're looking at that information as well. So that payer-based frequency chart, I understand what they were trying to do. It's caused more confusion, in my opinion. But who asked, right, Katie?
Right.
Any other questions that you would have for us as we continue to, as we're at the close of this, to just make sure we do have one more question. Our fiscal year, March the 1st. Well, let me see if I can get to it. Our fiscal year, March the 1st to March 31st, where does 5 months? Is that March 31st of 2021? So remember, there has been a delay in the calendar year 2020, so you will not be reporting calendar year 2020 anymore, or fiscal year 2020. You will be reporting fiscal year 2021 now. And so if your fiscal year starts on March 1st and ends on February 28th, or it starts on April 1st and ends on March the 31st, then it is 5 months following the end of your fiscal year. So in fiscal year 2021, your fiscal year would end March the 31st of 2022, which puts you 5 months into September of 2022, that you would need to have it reported by September the 30th of 2022. I hope that helps, folks. So just take your fiscal year And the start of your year will start in the calendar year, in the 2021 year. So whether it's January, February, March, April, May, June, July, August, September, October, November, it's 5 months following the end of in the following year. As well. Makes it easy. And Katie, just flip to this slide here and you will get the slide, if this helps as well, giving you a few dates and times of how that actually would work for you. And just make sure that you will have to have notified, folks, the entity of what you're counting. Usually it was 30 days. So if you've already been selected and you have not notified them, you might want to get with your contractor on that to determine if you have the ability to change it. That I'm not sure about. We'll want to follow up on. But the new people that are coming up in the next round at the end of this year, there is a timeline that you have got to get in if you're outside of a calendar year to report that in. So Monica, you asked a great question here. Our copays for Medicare and insurance that we send a patient are paid in our private pay bucket. Will that skew our Medicare amounts and insurance amounts collected? Just remember, when you're reporting, as Katie indicated earlier, if you have got the ability to have a secondary report to report all those copays and deductibles in, you would actually report it in that bottom. But if you only have access to what we call a primary payer report, which it lumps everything under the primary, so it doesn't matter, it puts all your Medicare dollars and secondary dollars that you may receive and patient dollars into one report, then you would want to note that on here that yes, it does include. If you got a separate report that you're going to be running that only looks at the dollars received by that payer, then you would say no, that does not include it, and then all of your secondary payments that you receive for deductibles and copays from your private payer is going to go in that bottom bucket. I hope that makes sense. Because there was a complaint about that some people could not, when they were going around doing a questionnaire and actually asking for stakeholder engagement, some stakeholders were indicating they could not bifurcate that out easily. And so this was their response to that, folks. And that is why we are giving this information and making sure, why Katie spent some time going through. So these are good questions to ask. See, Katie, if there's one more question. I think that got all of the questions. Okay, Megan, I'm going to turn this back to you. Katie, do you have anything else to say? Megan, we'll turn this back to you.
No, thank you, everybody.
All right. Well, thank you so much, Asbel and Katie, and thanks again, everyone, for joining us today. Again, we want to thank SAVIC for being our exclusive cost collection webinar sponsor. As we mentioned at the top of the call, I will send out an email this afternoon with a recording of today's presentation, the PowerPoint slides, and that NAC certificate of completion. I'll also include a link to the SAVIC Foundation grant in case anyone has not applied for that yet. And if you have any questions about today's presentation, you can respond to my email and I'll make sure to connect you with Asbel and Katie to get any questions answered. Otherwise, that's it for today, and we hope you all have a great rest of your day.